Hello and welcome. Thank you for joining in today's webinar about supporting well-being in agricultural communities. My name is Mike Strands, and I'm the Vice President of Advocacy for National Farmers Union. We're joined here today by three professionals who will be discussing wellness and behavioral health for all those involved in agriculture. Even in the best of times, farming can be a stressful profession. But in the last year, the regular day-to-day stress has been compounded by pandemic-related financial pressures, health concerns, uncertainty, and social isolation. It's been tough for everyone. So with that in mind, we're very excited to have these individuals with us here today online, and I look forward to hearing what they have to share with us all. This webinar is one in a series of virtual programming events taking place in advance of our National Farmers Union Convention. A schedule and recording of these virtual programming events can be found on our website. That's at www.nfu.org. Now that you're registered for this webinar, you should be able to receive notifications for those yet to come, most of which are on Thursday afternoons. So before we get started, I wanted to note just a few housekeeping items of business. First off, our panelists will be taking questions during the webinar. So please feel free to ask those questions using the Q&A box on your Zoom application. There's likely to be an opportunity for further questions at the end of the session too. If you have any technical questions or issues, feel free to ask those in the chat box, and an NFU staff member will gladly assist you with all that. Also, this webinar is being recorded, so if you'd like to watch it again or to share it with others, you'll be able to find a link on our convention webpage in just the next couple of days. And if you're unfamiliar with National Farmers Union, our mission is to advocate for family farmers and ranchers through education, legislation, and cooperation. We work to ensure that farm families and their communities are respected, valued, and enjoy economic prosperity and social justice. Farmers Union is a grassroots organization, and we work on a wide variety of issues. We would encourage all attendees to visit our website and explore the opportunities this organization has for you to get involved on local, state, and national levels. So with that, let's get started. I'm going to turn it over to our moderator today, Ruby Brown Herring, and she can take it from here. So thank you, Ruby, and take it away.
Thank you so much, Mike. And good afternoon, everyone, or good morning, depending upon where you are. We're excited to be here with you today as we talk about this important conversation of supporting well-being in agricultural communities. And before we get started, I'd like just to take a moment for our panelists to introduce themselves, and then we will start out with a little conversation around well-being in agricultural communities. So let's go ahead and start with you, Dr. Roseman, if you will, please. And then Dr. Karika will allow you to introduce yourself next.
Thank you, Ruby, and thank you to the National Farmers Union for sponsoring this. Just so you know, I am a member of the Farmers Union in Iowa and have been for many years. I would like to say a few words about agriculture and the kinds of stresses that we have. I am still a farmer, according to the IRS and the USDA. I'm also a clinical psychologist at Harlan, Iowa. So I bring that perspective. If there are other questions that you would like to know, you can find my contact information on the slides that Ruby will be showing. And I'm hoping that we all have an energetic discussion among us. Thank you.
Thank you, Dr. Roseman. Dr. Karika?
Yes, good afternoon. J.C. Karika. I'm the CEO of Southeast Health Group in Southeast Colorado. And first, I too appreciate this opportunity to participate today. Southeast Health Group is a community mental health center in Colorado. We serve the 6 southeast counties of the state. We are not in the mountains. We are very much flat. We are farming, we are ranching area. And we cover about 10,000 square miles. And one of the benefits we have here at Southeast is the utilization of an ag advisory committee that helps direct our campaign ads and our services. But I too am a farmer, rancher, landowner, and so I do take this stuff very serious and try to stay informed. Thank you.
Thank you. And I'll just share a little bit more about myself as well. Ruby Brown Herring. I am based in Raleigh, North Carolina, and I am not currently a farmer or a rancher, but I am a farmer's daughter. My dad was a farmer when I was growing up. So I'm just excited to share this space with our esteemed panelists today as we talk about such an important conversation. One of the things that I like to do as we get started is just to share my screen for a moment, just to get us to thinking about how we got to where we are with this conversation. And so this particular document that I always like to share with presentations, because oftentimes when we think about well-being, when we think about farm stress, we often don't know how to put it into context. And this graphic, I think, does a really good job with that. And so on the outside, you'll see the bubble that says anger. And what I encourage you to do is replace that word anger with any behavior that you may see or you may feel yourself. It could be sadness. It could be feeling overwhelmed. And oftentimes what we do, just because of our human nature, we focus on that outward facing behavior. But I encourage you as we go through this conversation to really take some time to reflect upon those underlying behaviors that we see on that wheel. And some of those are fear, loneliness, frustration, sadness, isolation, overwhelming stress, and a few others. And so once we start to think about those underlying behaviors that are and feelings that are driving those outward facing behaviors, it can help us understand, number one, what's causing that, what's causing us to feel those emotions. And then number two, how can we support those that we live, love, and play with, right? And how can we support ourselves? And so I think this gives us a really great starting point for today's conversation. And then the other thing that I'll share quickly is just so that we are, again, this is really about increasing awareness. And so how do we define mental disorder, mental health problems, mental health challenges? And so when we look at it, this definition, we really start to look at it from a perspective of it affecting a person's thinking, their emotional state, and their behavior. It impacts their ability to go to work, have satisfying relationships, so whether that's family, friends, or other individuals in their social circles, as well as carrying out those daily activities, which for many of you is work on your farms and on your ranches. And so when our emotions, when our feelings start to impact us in those areas for a prolonged period of time, that's what can lead us to conversations like what we're having today about potential developing mental health challenges or farm stress that could lead to additional challenges. And so what I'd like to start out with our panelists, Dr. Roseman and Dr. Karika, is, one of the things that we've talked about in preparation for this session today is, some of the trends that we're seeing. And what I'd like to do first is talk about, what are some of the, I like to start with bad news. What are some of the bad things that are happening in farming today? And then we'll transition from that to good news. But if you could share just a couple of comments around some of the bad things in farming that could be leading to some of the stress that we're seeing.
First of all, everyone knows that we are in our 6th year or longer of agricultural recession, where the bottom line sometimes doesn't meet the income line. So there is this long-term pressure to have a break-even point in farming, and that is true not only for crop and vegetable farmers that produce a lot of these, but also for dairy and livestock production. Crops actually are turning upward just a little bit, so in a sense that's some good news. I'd say one of the other difficult circumstances we find ourselves in is that we don't quite know what's going to happen at the federal level in terms of policy. That's why it's so important for NFU to weigh in on that along with other entities. what we see in terms of good news is encouraging. First of all, even though we have had a fairly long-term recession that is as severe as anything that we've experienced since the farm crisis of the 1980s, we have not seen a substantial increase in suicides or as great an increase in bankruptcies as we saw then. What we are seeing now is much more available resources, such as ag mediation to help us through disputes over lending and other matters. We see agricultural safety and health programs around the country. Farmers are much more psychologically minded than they were 20, 30, 40 years ago. It's not uncommon now for farmers to realize that managing our behavior is one of the few ingredients that we can control during these stressful times. You'll see this on the slides. I won't go through all the slides because they're available to you along with those supplemental readings. But to answer Ruby's question, the good news, I think, outweighs the bad news, and we're probably toward the end of this very difficult era that we've been through.
Thank you, Dr. Roseman. JC, is there anything you'd like to add to that from your perspective in Colorado?
No, it's very similar out here. I mean, the conversations around the coffee table or so to speak, the convenience stores is market volatility, both domestic, international, the uncertainty around policy, change in administration and what that may look for. That level of uncertainty just impacting the uncertainty that's we're already dealing with around social isolation and COVID restrictions. And so it's just the more the uncertainty grows in many different arenas that affect farmers and ranchers, the more that anxiety is manifested as well. You know, there was some research posted in the Ag Morning Clips, and it stated that 2 in 3 farmers and farm workers now say the pandemic has impacted their mental health. So 66% say it's impacted them. Another way to look at that is it's also saying more people are identifying mental health as something that they need to spend some time on. And like Dr. Roseman said, it's the psychological aspects that we're now addressing that maybe we've neglected for generations because we've been so focused on commodities and prices and weather, and now it's starting to turn inward.
Interesting. Thank you for sharing that. You know, one of the things that you made me think about as you were sharing that information, JC, was, you know, what, and this question is for either of you, what do you think is leading us to seeing more farmers, more ranchers recognizing these signs and symptoms that they may be feeling related to mental health challenges or farm stress? JC, I'll start with you.
I think what we're facing is a level of social isolation that we normally chose as a lifestyle. And now we're finding that it's at a whole new level, one of which we cannot control, one of which varies from county to county. How I respond in one region, what I can do may be different than another. That's frustrating to kind of understand what those barriers are. The inability maybe to attend gatherings, churches, attending sporting events, which is many places where farmers and ranchers get together on Friday, Saturday nights around football and basketball, and they connect. That may be their only exposure to town for the whole week. That inability to get together is been very, very difficult. And the variability between the county public health orders and the variability around state and federal guidance, again, things that we cannot control.
Yeah. Dr. Roseman, your thoughts? I'm sorry, Dr. Roseman.
Well, I agree with JC, and I would say that we have fewer, well, that farmers have always traditionally relied heavily on their own capacities rather than to bring together teams of people to assist them. That is changing slowly. Additionally, we are seeing the use of technology like smartphones to keep us in touch with people, and it has actually saved a lot of lives. I think that we can actually use the technology now to help bridge some of the gaps that we have with access to service, such as through telehealth. So I'm seeing kind of a mixed picture. I agree with JC, and it reminds me a little bit, JC, about several years ago, I was in La Junta, and I got up about 5 o'clock, went to the coffee table downstairs in the hotel, and I could see there were a number of farmers around there because they had on their farmer caps. And I introduced myself and said, "I'm a farmer from Iowa. May I join you?" And they said, "Of course." I said, "Have you had much rain around here?" And they said, "Heavens no. The last time it rained, why, we got a whole quarter inch. When it rained 40 days and 40 nights, we got almost an inch." So that was our opening up the discussion about how they are coping with stress in your area, JC. And it's, I think, apropos now. We do see some signs of drought here in the Midwest that are likely to occur without sufficient rains to get our crops established this spring. Those are the thoughts that occur to me right now.
Okay, thank you. And so one of the things that I'm wondering after, what you all just shared in terms of the challenges or the barriers or the things that are different because of COVID, do you think that farmers and ranchers and others in the agricultural communities, do you think they're more in tune with the feelings that they're noticing because of the conversations like this around farm stress? Do you, or are there other things that may be happening locally where you are to help increase that awareness? Dr. Roseman, we'll start with you.
Boy, absolutely, Ruby. I think we've come a long ways in terms of being able to talk about our mental health. For one, many of the times now we use the word behavioral health as a substitute for mental health. It's less stigmatized to use the word behavior. We understand as farmers how our animals behave, and we're attuned to that understanding of behavior. We can have much control over our behavior, as JC says. It's one of the few factors we control. Programs like this, the articles that appear in farmer magazines and weekly newspapers have done a lot to bring up behavioral and mental health issues and coping. It's rare to open up a magazine that's aimed at farmers without seeing at least one article. Here in my own hometown in Western Iowa, until COVID disrupted things, farmers were getting together on Monday morning and bringing an article with them to discuss. Somebody had cut out an article. Maybe it was a column that I had written, and they were saying, "I wonder what Roseman's saying about us now." Or in other cases, they were bringing in articles about depression, and they start talking about these things. Who would have heard of that 25, 30 years ago? Are you seeing anything like that out in Colorado, JC?
I absolutely am, and I couldn't agree more. Mental health is coming out of the shadows of the farm and ranch typical history. It has become, it's come from being in the shadows to actually being in the spotlight. The more we talk about it, the more my ag advisory committee gets out in the communities and the regions and talks about the services, the more emails I have coming in from community members saying, did you see this article? Did you see that article? This sounds pretty neat. Is this something we can do? It's like you, there's not a publication you can't open right now that doesn't have it at the forefront. Even equine magazines, roping, PBR stuff, it's all in there right now. And there's a huge amount of saturation coming around this topic and making it much more palatable to discuss around the table.
Ruby, would it be all right if we ask you to address that topic about what you're seeing in the Southeast?
Yeah, sure. One of the things that I think, that you all hit on is it really has been an increase in awareness. I know here in North Carolina in particular, we have the State Agro-Medicine Institute. That's a collaborative effort between 3 of our major land grant institutions, North Carolina State University, East Carolina University, and North Carolina A&T State University. And they really have done a great job doing a lot of outreach across the state. And I'm seeing that in the Southeast too, as we've had conversations with them about some of the partners that they worked with. And so I'm seeing a lot more conversations through webinars. I'm also seeing a lot of collaborative groups being pulled together to talk about solutions at the local level, because I think that's where the rubber hits the road, right? We know that it's an issue. We see it in all of our publications, but what are we doing locally to make changes for that? And so one thing that I'll mention quickly, and then would like for you all to comment too about what's happening locally there in your areas. Here in North Carolina, I was able to contract with the North Carolina Agro-Medicine Institute a couple of years ago, where we trained about 150 agricultural extension agents in the state in mental health first aid. And it was because primarily those extension agents were reporting back to their leadership. When I'm going out to these farms and I'm having conversations about, farm related stuff, I can't even get to that conversation because there's so many other issues that are weighing on the farmers' minds. And so I think that was really helpful to give them the tools that they needed to, number one, have those hard conversations, or even, how do they address some of those outward facing behaviors that we were showing on the opening slide. But I'd be curious to hear what's happening locally for you, Dr. Roseman. And JC, I do remember, I think you mentioned something that you all were doing as well.
Yes, there are a couple of things that I think I can address, and I hope that I'm answering your question, Ruby. One, I think significant change that is coming is that we have recognized a shortage of well-prepared professionals who understand agriculture and farming.
Yeah.
If we don't understand agriculture, we hardly have credibility as healthcare providers with farmers, especially when we're talking about things as tender as whether the farm is successful financially or not. These are very difficult things for people to address. If we look at what are the most stressful events that occur to farmers, our research over some 40 years has demonstrated that the most stressful event is the threatened loss of a farm. The loss of a farm due to financial problems primarily. Other events that are very impactful are the death of a child on the farm, because it signals the loss of the next generation. And it's about the only other factor that is as impactful as the threat of losing the farm. Other things follow, like the loss of a spouse or the loss of an important person in the farming operation, such as a father or a valued employee or a brother or something like that. So we now know more about the stressors, and we're finding that we have to function as social beings, even though we selected ourselves out to be farmers partly because we could work okay in isolation in the past. But now the time is here for us to make sure we have a network of supporting cast or people who can help us, like maybe a farm business manager or an agronomist or an extension expert in the area of our agriculture, or maybe in some cases a lender or a counselor, someone who is either with the extension or a licensed professional in some mental health discipline, like counseling or marriage and family therapy, social work, psychology, and so forth. So there are some real beacons of hope. One of the things I'm just going to mention is the new Farm and Ranch Stress Assistance Network that has become part of the 2018 Farm Bill and was recently funded for the 2021 budgetary year. If you'd like me to go into that a little bit more, I can, or you can certainly find it in some of the articles that I've attached.
Thank you for that, Dr. Roseman. I'm going to come back to that because I'm going to connect that to our financial stress conversation. JC, my question for you, can you talk about some of the local initiatives that are happening there in Colorado that your organization is involved with to address some of the challenges of farm stress and mental well-being?
Absolutely. In the fall of 2018, unfortunately, we had 4 suicides in a county of less than 1,200 residents, all of which had ties to farm ranch lifestyle. And at that point in time, I realized that we needed to look at farm workers as a culture in itself. And we need to become more culturally competent as an organization, much of which Doc mentioned a minute ago about the competency to treat that population. Well, while I had my own thoughts from my experience, I realized that I didn't have a lot of expertise on staff. So I reached out to some organizations in the region and said, would you be willing to have coffee? Initially, that group was 4 organizations that came forward. And when I called them, they all had an experience in the last 30 days, either personal or professional, about somebody in distress and not knowing how to handle it and feeling uncomfortable if they were to address it, what to do. So we got this group together and we started an ag advisory committee, and this committee now travels the state and shows other regions how to develop ag advisory committees. And that committee builds its own platforms, its own marketing material with the help of the Mental Health Center to address that culture. And what we do along the way is we ask for investors, but not in the sense of financial. It's more of trust and time. And we say, do you trust this movement enough to put your logo behind it? And they do. And we have the livestock commissions, we have the John Deere dealerships, we have the Chevy dealerships, large ag lending institution, some private farmers, ranchers themselves that sit on this group. And they direct the Mental Health Center on next steps and focus areas. So 3 real quick things, I won't go too long, but 3 things that are very important to them we found in the first year was, one is they wanted to understand how to have conversations with people that may be in need. And they didn't want to go to the level of a mental health first aid, which we do. They said, JC, you've got 90 minutes to teach us how to have a conversation and address somebody that may be in distress. And so we started using a product out of the University of Colorado called Comet. That was the first thing, and it's a conversation starter. That's all it does. The second thing is Colorado had red flag legislation going through around gut, and some people look at it as gun control, but the red flag legislation was about possession of firearms while a person may be in distress. And Doc, back to what Doc had mentioned earlier, is the importance of people to own the land and pass the land down. Well, guns are very similar in nature. Those are some of the things that people only own and don't have any debt against. Those are things that are handled generation after generation. And so this group said, we want to go around and educate people about what the new laws are, what the new laws aren't, and what they can do to prevent finding themselves in a situation where they may have to surrender those heirlooms. And so red flag legislation was the second thing that we started going around and educating communities on, the do's and the don'ts and the realities around the law. The third thing is as the pandemic happened, they said, JC, we know we need services, but we can't get off the tractor, or we can't leave the feedlot. We can't take a whole half day to go in for services, because then I feel guilty. I'm getting even more behind, and it perpetuates my issues. So we went out and bought 100 iPads, and we started telling people, if you want services, we'll get them to you. And if you want to put them in the tractor with you or on the pickup seat, and you want a 15-minute contact, and that's all you've got, there's an access button that they hit on the iPad, goes them straight to a counselor, and will serve as long as they have the need or the ability to give us the time. And those come with data packages already built in them. And so as long as there's connectivity, which can be difficult in rural frontier areas, we can now deploy devices and meet people where they're literally sitting or where they're at. And those all three initiatives came out of the advisory committee.
That is great. That is great, JC. And it made one of the questions that we have that's been submitted was, can virtual counseling or virtual support groups effectively provide mental health care services for farmers looking for help? And I think the example you just provided is a great great towards speaking towards that. But because I know your agency does provide mental health services, are there some additional thoughts that you have around virtual telehealth and access to, particularly some of the rural and frontier areas that you've talked about?
Well, the barrier, we can only get as far in teleservices as broadband and Verizon or other AT&T packages allow us to get access. With that said, we are now taking staff and deploying them to homes and to residents so that people do have access. Many people early in the commitment to service or to address their behavioral health issues are afraid of the stigma of their vehicle being in town, right? If I drive a red Ford 1-ton flatbed with a blue healer all the time in the back, undoubtedly we all know who it is parked in front. And that has been a huge barrier. And although I've seen significant change in 5 years, as people become more comfortable with services, they'll start coming in. But the initial courage to engage in services is a little more delicate, and we've got to meet people where they feel comfortable at that time and not let that opportunity pass by.
Right. Yeah. Thank you for that. You're exactly right. When you mentioned that about the truck, I immediately thought of my childhood here in southeastern North Carolina, because that's the way it was. I lived out in a rural area, 20 minutes to town, 25 minutes to town, and we knew that X building was the mental health clinician in the nearby town, and folks would not be caught with their vehicles sitting in front of that. And so I think, you really hit a point in terms of how that stigma has impacted folks accessing services. And I love the fact that you all have gotten creative and found ways to provide technology to meet farmers where they are. So instead of saying, you've got to stop and come to us, you came to them. And I think, that's really a neat model that I think a lot of folks could learn from. Absolutely. And so Dr. Roseman, are there any similar initiatives where you are in Iowa in terms of local initiatives to meet the mental health care needs of farmers and ranchers?
Very much so, Ruby. We did about 20 years of research in a 7-state upper Midwest region that included Wisconsin, Minnesota, North and South Dakota, Nebraska, Kansas, and Iowa. And we found that the most effective services were those that were delivered by wise people who understand agriculture. They didn't always have to be a licensed professional. Good mentors, neighbors who know how to maintain confidentiality, highly respected people can be part of that network of team that I think JC is describing. We have also found that it's important to go out to farmers at least once or more to get the look of the land, the operation. Are the buildings painted? Are the cattle getting enough nutrition, or are the pastures bitten down so far because there's an effort to raise one or two more animals in a given pasture? It's important, I think, also because it sets a bond. Now, the people who go out and provide the counseling have to know their limits, but they also have to understand agriculture and when to bring in outside expertise while working with the person. A lot of this can be delivered after we have established a relationship by one or two on-farm or on-ranch visits, followed up then by virtual meetings. So I like what JC is saying because it's precisely what we have found to be a best practice.
Fabulous. Thank you for that. Thank you. And so one follow-up question for you, JC. We had a question. Could you please repeat the name of the program that you were discussing where you provided the iPads to farmers?
So the iPad software program that comes loaded is called MyCare. And I believe it's actually comes out of Oklahoma, but the product is MyCare. And that's the software that comes preloaded, and the iPad is preloaded with data packages. If somebody is wondering about the conversation starter curriculum, that's called COMET, C-O-M-E-T, and it's out of the High Plains Research Network. You can Google that and it'll come right up. And that's part of the University of Colorado Department of Family Medicine. But that was a grassroots developed product by Northeast Colorado community members, not researchers. And they wanted to build a product that was common language that you would use on the street to engage people to talk about what stressors they may be experiencing. So COMET is the product. High Plains Research Network is the organization that leads it.
Thank you so much for that, JC. And I'm going to read one resource that's mentioned that was sent to the panelists from Sarah Gideon that says the Kansas Corn Commission is also working on an option to provide cultural education to providers on where their ag producer patients are coming from when they need assistance, and providing an identifier on a website. And so that information is available on the Kansas Department of Ag Farm Stress website. And I'll make sure that I add that to the resources that we make available after this session ends. So thank you for sharing that. One of the things that just really spoke to me as both of you were sharing kind of those grassroots things that were happening that I think it's important for folks that are attending today to pick up on is that this can't happen in silos, right? We've got to all work cross systems. And so you've got the medical community and the behavioral health community working with the subject matter experts, the farmers and ranchers and folks in the agriculture community that knows what's happening. And so my call to action to folks that are listening today or maybe watching this on replay later is thinking about, if you haven't started these conversations locally, start to pull folks together that have the same interest so that you can begin these conversations at the local level. Because what tends to happen, and I've seen this happen here in North Carolina too, you have the researchers, you have the medical communities that say, oh, great, we're going to provide this, we're going to do this, but they're not able to do it from the lens of the agricultural world. And so the neat thing I think about JC and Dr. Roseman is that they have the medical background, but they also have the subject matter of being a farmer or rancher or whatever the case may be. And so thinking about how you can continue these conversations locally, because that's where we start to see change and even more impact. There's a couple more questions that are coming into the chat, and I appreciate you all for sharing these, and I'm going to try to get to as many of them as I can. But one of them is from Alma Jorgensen, and her question really speaks to legal concerns. And so are there any legal concerns with practitioners physically going to the farm? And she's asking that as someone who hopes to be a mental health practitioner in the next 5 years. So JC, I'll start with you on that and then let Dr. Roseman chime in as well.
So yes, there is. What you need to be very careful about is when you talk to your insurance company, you make sure that you have a rider that talks about doing non-site based care. And so there's really, I wouldn't say any legal concerns. It's more of, is your insurance covering what you're going to do? And that typically is an add-on, right? Most insurances cover brick and mortar services, but once you do things that are more mobile, whether it be a mobile clinic where they meet you at an independent location, or you do it at a home of the consumer, those things need to be clearly discussed. You also want to make sure that you update your policies and procedures very clearly and indicate what type of safety precautions you take, and checking in, checking out, connectivity in case there's an emergency, you have a way to make phone calls. So there are some pieces you need to really think through there.
Thank you for that. Dr. Roseman?
I think I heard you say that you were wondering about legal issues, or your caller was. I'd like to mention that if and when a team of supporters is formed to help a farmer or rancher in trouble, it's probably best to not involve an attorney to begin with. Involving an attorney sometimes signals that we're going to take a hard line legally, and it makes people a little skittish to participate in a collegial effort to solve the problem. There is a time and a place, of course, for legal advice, but that is mostly after every other option has been dissolved. There are wonderful other resources like ag mediators that can solve disputes jointly without bringing in the legal profession except for executing some of the documents. There's also, I think, a time to try to figure things out yourself rather than to let an attorney take charge of the matter. The more we own up to, or we own those problems and we own those solutions. So let's try to find them without going the big step of legal advice in the long run. I'd also like to mention, Ruby, that in Kansas and in many other states, the ag mediators are some of the best trained behavioral health counselors to work with farmers and ranchers. And they are in many states. All agricultural states do have a farm mediation program, and you can look it up online just by Googling the words or doing an online search with the words like state farm mediation program, filling in your state like North Carolina.
Thank you for that. And one thing that I'll add to that question about legal implications for for mental health professionals going out to the farms is really to think about from your insurance perspective, right? And so are there any potential issues with insurance not covering those visits? And so doing research around that as well.
Most states now do require reimbursement of professionals for conducting or telehealth visits. They also usually cover visits that are done on site, that is at the farm or ranch. So it's not so much an issue of reimbursement. It's more an issue of what can be most effective in order to help the people who are distressed come to terms with their circumstance and solutions. I don't believe in most states there's a problem with reimbursement using the modern technology.
Yeah. Thank you for that. And I think you're right. And I think especially because of COVID, we've seen, I know here in North Carolina, we've seen a lot more flexibility with that as well.
Okay. There are a lot of waivers out there right now that have assisted, but it is important that both the provider and the recipient make sure that those waivers are still in place if the policies don't change.
Yeah. Yeah. And that's one of I work full time for the state of North Carolina Division of Mental Health. And one of the things that we have been having a lot of conversations about internally is just that. We've seen, I think there was hesitation leading up to COVID, right, about the flexibilities with the waivers and how payments were made, particularly with various payer sources. But we've now noticed because of COVID that it works, right? And we've seen folks that may not have been able to access services previously are now getting services. And so we're doing everything that we can to make sure that these flexibilities continue after COVID ends, because we definitely realize that folks are getting help that they so desperately needed. Let's see, we've got a couple more questions that I want to try to get to as we start wrapping up in a few moments. But I think this one goes back to, how we started off with some of the stigmas around mental health challenges. And so the question from Hawthorne McCracken is, how much of the negative mental health outcomes that farmers experience do you think are related directly to the work? And how much do you think are related to the individualistic stoic culture in many areas of agriculture? Would either of you like to speak to that?
That's a difficult question. I think that it is more a problem of stigma because we worry about what others will think of us. And that's why it is important to have programs like the new Farm and Ranch Stress Assistance Network. That is part of the 2018 Farm Bill. What it does, it sets up 4 regional centers around the country, one in the Northeast, the Southeast, the Midwest, and the West. I can go into those more, but for the sake of time, let me just say that these 4 centers all are at universities, but have local partners, like the Southeast program affiliates with the AgriSafe Clinic network. The Farm Aid program and the Young Farmer program in the Northeast affiliate with the University of Vermont. The Farm and Ranch Stress Assistance Network tries to make small grants available to communities where they want to address issues of farm stress or suicide and to do something about them. The 4 regional centers are designed to provide technological, or I should say technical advice about what works, but to also help train the professionals to understand agriculture better. They also can help set up community meetings as ways to talk about mental and behavioral health openly, and what works and what doesn't work so well. What are the signs of suicide and severe stress? It only has $10 million per year, but when you pair that with state resources like state legislative actions and private foundations and funders, including agricultural companies and their foundations, when you put those all together, we can build a better network. We're not nearly to the point where the ag safety and health programs are that you have mentioned, and I know the North Carolina program very well. But we're seeing the approach to doing this kind of work with psychological perils as well as physical perils associated with agriculture.
Thank you for that, Dr. Roseman. And so could you just share with us how farmers and ag service providers might become part of the Farmers Ranch and Stress Assistance Network?
Well, already there are efforts underway to train all of the extension persons around the country in mental health first aid, psychological first aid, or other types of courses that can be taught in a day or so. There's also training programs to equip Farm Service Agency personnel, National Resource Conservation Service personnel, and risk management personnel in extension, all to better understand the signs of severe stress, suicidal potential, danger to self or to others. So the Farm Service agencies, I think over the next year or two, will be doing a lot to provide brochures and information about where farmers and ranchers can turn to for assistance locally. So that is the aim. That is a supplemental effort that was passed in this past November as part of the 2021 budget bill. So there are some resources there, and you can look up Farm and Ranch Stress Assistance Network online and get local information. But also consider approaching Extension because they're very much familiar with this program now.
Thank you for that, Dr. Roseman. JC, I'm going to start with you for our next question, and it's really tying back to cultural appropriateness and responsiveness. And so, do you know of any culturally appropriate mental health services for Latino farmers that are in Spanish in your area? And so, the individual asking the question says, that's one of the areas that she's finding challenges, finding enough Spanish resources in the farming community.
Unfortunately, I don't. I saw that question and I appreciated it. And I've been sitting here for about 5 minutes trying to rack my brain on anything I could come up with to provide a direction or resources. Just a general workforce shortage of farm ranch competent behavioral health providers is so hard just in general. I think Dr. Roseman mentioned that before about we almost need to adopt like translation services where you take a therapist that does therapy well and you co-facilitate it with somebody that has the experience, at least as a warm handoff to build that confidence, to build that knowledge base and continue to teach that provider as you go along. Don't stop. I'm wondering if this is a similar dynamic. That's what my mind went to, because I don't see, unfortunately, the shortage getting any better. So how can we co-facilitate arrangements that would be emerging best practice, but maybe not the best way to do it right now.
Yeah, thank you for that. Thank you for that. And I think we've gotten some resources mentioned in the Q&A too. And so what I'll do is compile what's been shared and make that available afterwards. And so we're coming up on our last few minutes. And what I'd like to do next is just take a couple of moments just to ask each of you to share what you have noticed that folks are doing in your areas to provide self-care, to provide wellness for themselves, or tips of things that you've done for yourself that have worked.
Well, a lot of these tips are in articles that are coming out in farm publications, but I think we're seeing a new era in extension with them coming to grips better to help communities equip themselves to serve their population who are involved in agriculture. That has always been the mission of the extension, but now they are the community organizers in many cases. It is incumbent on people in communities to bring together the movers and shakers to figure out what to do and how they want to do it to best serve their community. What works in dairy farmers with dairy farmers in Wisconsin might not work with the Hispanic farm workers in California or elsewhere. I would like to mention also that Proteus clinics, migrant councils, and farm worker organizations have some acceptance by the Hispanic population, and they are a place to turn, but there is a clear deficiency of culturally appropriate services for people of Hispanic backgrounds who are involved in ag.
Thank you. JC, do you have any self-care tips that you'd like to share with folks as we wrap up our conversation?
I do, a little more at the granular level. And I always lead with know your public health orders, unfortunately, because it does change in 30 miles, maybe. But what I am seeing and what I am doing is I'm seeing and encouraging people to just get in their vehicles and take a drive, right? It's a safe way to get out, drive around. Rural and frontier areas, we can drive for days, right? It's quiet. Reconnect with sunsets. Get coffee at 5 in the morning, see the sunrise. Do it with your family. Take your kids to school instead of throwing them on the bus. It's not unusual for us to drive 80, 90 miles one direction to get a nice meal, right? Reconnect with family and, reconnect with friends. If you see somebody that's not getting out or they may be a little bit distressed, at least once a week, I reach out or I have somebody reach out to me and we have lunch, we have a dinner, we grab coffee, Starbucks, whatever you got, loaf and jug, black coffee, and we just drive, right? Go see what water's in what ditches. Go look at the conditions of the places. But remove the isolation, get out and about, reconnect. If your churches are back face to face again, try to get back in if that's an opportunity. Coffee shops are starting to open up at the convenience stores again, where they're allowing groups of 3 or 4 people to gather. So reconnect. I mean, that's the best thing I could do, and it doesn't have to be expensive. 25-cent cup of coffee and a 30-minute drive on the back roads goes a long ways for everybody's mental health and well-being.
Yeah.
May I follow up just a bit on
sure,
what you
Dr.
said,
Rosemary.
JC? I think you've hit on a very important matter, and that is that we farmers have to take care of ourselves because nobody else is going to. And if we don't take good care of ourselves and manage our behavior by taking respites, taking breaks, short vacations, talking with trusted people, even behaving in ways that give us comfort. Just like cattle, stand next to each other and lick their necks. We humans produce our serotonin when we stroke our arms and give hugs. Now that's not always possible in the COVID era with other persons, but it is within the family where we live. So those are just a few practical things that I wanted to mention here. Thanks.
Yeah. No, thank you for that, Dr. Roseman and JC, because you're both right. Those are some of the things that I've often shared with folks that are, when I talk about well-being and self-care, you don't have to spend money. I love the idea of getting in the car, because I did that in the beginning of the pandemic. And I would Sunday mornings, my family knew at 11 o'clock, around 11 o'clock, I'm in my car and I'm just going on my Sunday stroll, and I would take every road that I could find just to get out of the house, see something new, and just feel refreshed. And so as we leave our conversation today, we've talked about everything from, some of the bad news that's happening in the agriculture community, some of the great news that's happening, some of the challenges as it relates to farm stress and mental well-being and financial well-being. But I think, one of the most important takeaways that we want all of you to have, aside from what can you do locally, is what can you do for yourself and those that you love. And it's about creating that human connection in any way that you can. I remember growing up, sitting on the tailgate of my daddy's truck at the edge of the field. And so maybe that's how you are able to connect with folks at a safe space. And so thinking about what works for you, but just being creative and making connections with those that you love and those that you care about. And when you find that you are feeling overwhelmed, when you're finding that you're seeing some of those outward facing behaviors in that little red bubble, stop for a moment just to pause and think about what's driving that, what's causing some of that, and then reaching out to individuals that you've identified as your go-to individuals that can support you and help connect you to the appropriate professionals that can support your mental well-being, because there are resources available. There may be challenges, but at least try to reach out and find ways that work for you, because what works for me doesn't work for Dr. Roseman and doesn't work for JC. And so we thank you for your time here. And as we wrap up, are there any closing comments from JC or Dr. Roseman?
Just to say thank you, and if people would like to contact me, please do it by email. Thank you.
Thank you.
Yeah, just appreciate the opportunity to talk today and listen to and you see those questions and know where people are at, because those questions also derive our direction and the needs and give us a better vision of what needs to happen for change. So thank you.
Yes, thank you. And I'll say to the staff at the National Farmers Union, thank you again for providing this opportunity and this conversation that's so very needed, as evidenced by the questions that were coming in today. And so I'll turn it back over to Mike and Abby to wrap us up. But thank you all and enjoy the rest of your day.
Yeah, thank you all. We really appreciate you being on the line. Panelists and participants, we're really grateful for your willingness to engage with on what can be kind of a tough topic. Farmers Union has been working on farm stress and mental health for some time now through legislative efforts and educational opportunities. Our states are doing independent things like voucher programs and hotlines. I see some familiar names on our participation list of some of those individuals who work really hard on those programs.